Your cat hasn't eaten in 24 hours, and you're starting to panic. Should you rush to the emergency vet or wait it out? Here's what most cat owners don't know. Cats can develop serious liver damage if they go without food for just 48 to 72 hours, especially if they're overweight. Today I'm breaking down the 8 most common reasons cats stop eating, which ones are emergencies, and when you actually need to worry. Some of these causes are harmless, but others require immediate veterinary attention. Let's figure out what's going on with your cat. Why this matters so much. Before we dive into specific causes, you need to understand why appetite loss in cats is more serious than in dogs. Cats are obligate carnivores with unique metabolism. When they stop eating, their bodies start breaking down fat for energy. But cats aren't efficient at processing fat, and this can lead to a condition called hepatic lipidosis or fatty liver disease. Hepatic lipidosis can develop in as little as 48 to 72 hours of not eating, especially in overweight cats. It's a life-threatening condition that requires aggressive treatment. This is why the answer to should I wait or should I go to the vet depends heavily on how long your cat hasn't eaten and whether other symptoms are present. As a general rule, if your cat hasn't eaten anything for 24 hours, call your vet. If it's been 48 hours, get to a vet immediately, regardless of whether your cat seems otherwise fine. Reason number 1, dental disease and mouth pain. The number 1 medical reason cats stop eating is pain in the mouth. Dental disease is extremely common, affecting over 70% of cats over age 3. Here's what dental problems look like. Your cat approaches the food bowl, sniffs the food, maybe takes one bite, then walks away. They might cry or vocalize when trying to eat. You notice drooling, especially with blood-tinged saliva, bad breath that's worse than normal cat breath, pawing at the mouth or face. Common dental problems include gingivitis, inflammation of the gums that causes pain and bleeding, tooth resorption, where the tooth structure breaks down, extremely painful and common in cats, fractured teeth from trauma or chewing hard objects, oral tumors, less common but possible, especially in older cats. Cats with dental pain want to eat. They're hungry, but the pain stops them from actually eating. The key clue is that they show interest in food, approach it, but don't follow through. If you see this pattern, dental disease should be your first suspect. Treatment requires veterinary dental care, often including tooth extractions, professional cleaning, and pain management. The good news is, cats do remarkably well after dental treatment, even with multiple teeth removed. Reason number 2, digestive upset and nausea. Nausea and digestive upset are common reasons for appetite loss. Cats can't tell us they feel sick to their stomach, but loss of appetite is often the primary sign. Watch for lip licking and excessive swallowing, signs of nausea in cats. Hiding or seeking out cool surfaces like tile floors, sitting in a hunched position. Vomiting, either food, hairballs, or bile. Diarrhea, or changes in stool. Common causes of digestive upset include hairballs creating blockages or irritation, eating something they shouldn't have, dietary indiscretion, intestinal parasites, inflammatory bowel disease, and pancreatitis, which is more common than many owners realize. Mild digestive upset might resolve on its own within 12 to 24 hours. But if your cat is actively vomiting, has diarrhea, or shows signs of pain like the hunched position, don't wait. Pancreatitis deserves special mention because it's often overlooked in cats. Signs include decreased appetite, lethargy, sometimes vomiting, and abdominal pain. It requires specific diagnosis through blood tests and often needs hospitalization. If your cat shows signs of digestive upset along with not eating, veterinary evaluation is warranted sooner rather than later. Reason number 3, stress and environmental changes. Cats are creatures of routine, and many will stop eating when stressed or when their environment changes. Common stressors that affect appetite include moving to a new home or rearranging furniture, new pets or people in the household, construction noise or disruptions, changes in feeding schedule or location, even changing food brands suddenly. Stress-related appetite loss looks different from medical causes. your cat is otherwise acting relatively normal, no vomiting, diarrhea, or obvious pain signs. They might be hiding more than usual or seem more anxious. The appetite loss coincides with an identifiable stressor. If stress is the cause, your cat will usually start eating again within 24 to 48 hours once they adjust, especially if you take steps to reduce stress. Here's how to help. Keep the food bowl in a quiet, safe location. Maintain regular feeding times. Provide hiding spots and vertical spaces. Use calming aids if needed, though consult your vet first. However, don't assume stress is the cause without ruling out medical issues, especially if the appetite loss extends beyond 24 hours or if any other symptoms develop. Even stress-induced appetite loss can lead to hepatic lipidosis if prolonged, so you still need to monitor closely and intervene if your cat isn't eating by the 24 to 48-hour mark. Reason number 4. Respiratory infections. Upper respiratory infections are extremely common in cats and often cause appetite loss. Here's why. Cats rely heavily on their sense of smell to stimulate appetite. When congested, they can't smell their food and lose interest in eating. Signs of respiratory infection include sneezing and nasal discharge, watery or crusty eyes, congestion and noisy breathing, lethargy and decreased activity, and loss of appetite. This is especially common in young cats, cats from shelters, or multi-cat households where infections spread easily. The good news is that mild respiratory infections often resolve on their own in 7 to 10 days, but you can help your cat eat in the meantime. Warm the food slightly to increase aroma. Use especially smelly foods to stimulate appetite through whatever smell they can detect. Keep their nose and eyes clean by gently wiping away discharge. Use a humidifier to help with congestion. However, if your cat isn't eating at all due to respiratory infection, they still need veterinary care. Your vet can provide appetite stimulants, anti-nausea medication, and sometimes antibiotics if a bacterial component is suspected. Cats with respiratory infections who stop eating entirely are at high risk for hepatic lipidosis, so intervention is important. Reason number 5. Food, preferences, and pickiness. Sometimes the reason is simple. Your cat doesn't like the food you're offering. Cats can be notoriously picky, and some will hold out for their preferred food. This looks like approaching the bowl, sniffing, and walking away without eating treats or other foods but refusing their regular meal. Acting otherwise completely normal, active, playful, and healthy. Common reasons for food rejection include the food is stale or has been sitting out too long, you changed brands or flavors suddenly, the food is too cold, straight from the refrigerator, or the bowl is dirty or has residual odors. True pickiness is only a safe assumption if your cat is otherwise completely healthy, acting normal, drinking water, and hasn't gone more than 24 hours without eating anything. If it's been over 24 hours, even a picky cat needs veterinary evaluation to rule out medical causes. Don't let pickiness become an excuse to delay necessary care. To address pickiness, try warming food to room temperature or slightly warmer. Offer different textures like pate versus chunks, ensure bowls are clean, and don't leave food sitting out for hours. Reason number 6. Medication side effects. If your cat recently started a new medication and stopped eating, the medication might be the culprit. Many drugs cause nausea or decreased appetite as side effects. Common medications that can affect appetite include antibiotics, pain medications, anti-inflammatory drugs, and certain supplements. If you suspect medication is causing appetite loss, don't just stop the medication. Contact your vet. They may be able to switch to a different drug, adjust the dose, or provide anti-nausea medication to help. Never discontinue prescribed medications without veterinary guidance, especially antibiotics which need to complete their course. The timeline matters here. If appetite loss started within a day or two of beginning a new medication, the connection is more likely. Reason number 7. Underlying illness. Many serious illnesses present with decreased appetite as one of the primary symptoms. These include kidney disease, extremely common in older cats, liver disease, hyperthyroidism, diabetes, cancer, and infections like FIV or FELV. When underlying illness is the cause, you'll usually see other symptoms too. Weight loss over time, increased thirst or urination changes, vomiting or diarrhea, lethargy, or behavior changes. These conditions require blood work and sometimes additional diagnostics to identify. This is why veterinary evaluation is so important when a cat stops eating, especially if they're middle-aged or older. The challenge is that early-stage illness can present with very subtle signs, with appetite loss sometimes being the only obvious symptom initially. This is another reason why the 24 to 48-hour rule is so important. Waiting too long can allow illness to progress unnecessarily. Reason number 8, recent vaccination. If your cat received vaccines within the past 24 to 48 hours and stopped eating, this might be a mild reaction to vaccination. Temporary appetite loss for 24 hours post-vaccination can be normal. Mild lethargy accompanying the appetite loss is also common. However, if appetite loss extends beyond 24 hours, if your cat seems painful at the injection site, or if other concerning symptoms develop, contact your vet. Most cats bounce back from vaccination side effects within a day. If yours doesn't, something else might be going on that warrants investigation. Appetite loss in cats is never something to ignore for more than 24 hours because of the risk of hepatic lipidosis. The 8 reasons we covered range from minor to serious, and many require veterinary diagnosis to differentiate. Trust your instincts. If your cat doesn't seem right, get them checked. Early intervention prevents complications. Thanks for watching. Subscribe for more cat health content and comment below, what made your cat stop eating and how did you solve it? Your experience might help another worried cat owner.